Dr. Thea is a general gynaecologist with post-fellowship training in laparoscopic surgery, endometriosis, and pelvic pain, and provides care for women seeking hysterectomy, fibroid treatment, and management of ovarian cysts. As a published contributor for the seminal Australian textbook in obstetrics and gynecology, Thea continues to be involved in research and medical education. Dr. Bowler is also the current chair of the Queensland Persistent Pelvic Pain Network. Her passion for women's health extends to working with adolescents and women with hormonal conditions, including polycystic ovary syndrome, menstrual disturbance, menopause medicine, premenstrual syndrome, or PMS, and premenstrual dysphoric disorder, PMDD. Now, I've just struggled to get through all of that, and you actually are an expert in all of them. So welcome to the Hub, Pure Health Hub, Thea. It's lovely to have you here.
Thank you so much for having me along. I'm very excited to be here.
It's a treat. Now, according to Health in Aging, older women are more likely than men to have chronic or ongoing health conditions such as arthritis, high blood pressure, and osteoporosis. Women are also more likely to develop multiple health problems, according to a recent report from the Kaiser Family Foundation. So with all that in mind, why are we more susceptible to chronic and multiple health conditions than men?
It's a very, very good question. And I think it's definitely a statistic that has been borne out in lots of different studies that women do tend to suffer from more inflammatory and autoimmune conditions, and often overlapping conditions as well. And while there is no sort of definitive consensus about why this might be the case, I think there are probably a few reasons. We know that there are probably hormonal reasons and hormonal causes for women's predisposition to autoimmune conditions, and probably estrogen has been implicated in those, as well as what is emerging to be probably a genetic link as well, in terms of the way that one of our X chromosomes is inactivated. So usually we only use the genes from one X chromosome, and it might be due to this other X chromosome and variable expression of certain genes on the inactivated one that might be causative as well. And then I think there's also cultural and behavioural reasons why women probably are more prone to chronic conditions, in terms of the way that women are often carers for other people, often putting themselves at the back of the list of things they need to do and look after, and probably often not prioritising their own health while caring for others. Yeah,
it's so true. So there's the mental health behind that as well that we neglect.
Absolutely.
As you say, because of all of that, and some of these, the connection between the mental health and the inflammation and the gut health and all of these things are all interconnected, aren't they?
Right.
It's not always able to put the pin, put the nail there, but so that's interesting that you say that. So it really has got something to do, and I won't say lifestyle, because it's more about behavioural, as you say.
Yeah, that's right.
So it's because we become neglectful, self-neglectful.
Yeah, that's right. And it's almost like women's roles culturally are, women's roles are kind of detrimental to their health, in that they take on this caring role for other people and often aren't looking after themselves as well as they should be. Yeah.
And also, just going back to that inflammatory element, that can that trigger multiple conditions when you've got inflammation in your body?
Definitely. I mean, in gynecology alone, we know that, a huge number of the conditions, polycystic ovarian syndrome, endometriosis, to name a few, are really based on an abnormal inflammatory response. And that certainly is coming to light in many other conditions throughout the body as well, from vascular disease and diabetes and everything else. So yeah, I think that's probably a huge part of it. Yeah.
complex lot. So
Yes.
it seems the further that we delve into women's hormonal conditions, particularly, the more complex it becomes, and probably just isn't just hormonal conditions. It's all of those things we've just talked about. The more complex it becomes, but that's in both the condition and the treatment. So just looking at, because there's new things every day. I mean, I can't imagine what you learn every day, but what would be one of the greatest recent learnings in women's health?
Oh gosh, there's so many.
Try and pluck one.
I think like it's sort of boring, and you've alluded to it already, but I think what we're learning about gut health and the gut microbiome is just absolutely mind-blowing, and the far-reaching effects that it has on, every organ system, but certainly in gynecology, the effect that gut health and the microbiome and dysfunction within the microbiome can have on almost every gynecological condition, every hormonal condition, certainly menopause, endometriosis, PCOS, PMDD, all of these things are really, it's coming to light that they're really strongly linked with gut health and dysbiosis in the gut microbiome. Even, there are some theories that altered estrogen metabolism within the gut can have an impact on breast cancers. So yeah, I think that's probably one of the most fascinating things, and is something that certainly in gynecology we probably overlooked in the past, but more and more now starting to incorporate that into our treatment for various gynecological conditions is really important.
So the gut health really is taking a holistic approach to your health, because it's coming out, as you say. So it really is coming out as a major factor in a lot of other physical ailments.
Yeah, absolutely.
Wow. And I have spoken to some great minds in that space, but it's good to hear it. It's coming from everywhere.
Yes, that's right.
Talking about
I think no aspect of medicine can ignore it anymore.
Yeah, right. Well, that's good to hear, because if medicine's taking that on and using that, Pure Health Hub's missive really is about owning your own health journey, and by knowing that, I think it just we can empower ourselves a little bit more.
Absolutely.
It almost, it's not simple at all, but it almost makes it a little more simple by saying, if you've got great gut health, it's you're on your way, sort of thing. So I think that's, even though it's a very complex area, but it still simplifies it, I guess, a little bit, if we can keep that healthy. So talking about self-care, there's a lot of chat about self-care, and we say that we neglect ourselves, and that's true. And we're starting to take mental health breaks, and they're lovely when you have a nice luxurious bath or you catch a movie with girlfriends. But from a holistic health perspective, what else should we be doing? And I guess maybe it comes back to gut health.
I don't know, the self-care thing is a funny term, isn't it? Because I agree, like when we're talking about having long baths or getting massages and stuff, that is a small part of it. But I think what so many of us are lacking is not even a physical thing so much, but a connection to ourselves, having the time to actually think about what it is that we love, what brings us joy, what brings us a sense of calm, and I guess as an extension of that, having the time to do those things. So many women are, as men are as well, but so many women are kind of, just burnt out trying to be the full-time worker, the mum, the career woman looking after relatives, that they don't have.
Sister, auntie, everything.
Be everything to everyone else to the detriment of, yourself and loving yourself and spending time, thinking about the things that bring you joy. So I think that's like at the crux of it. But really, if we're talking about sort of holistic health related measures, I think, thinking about things that nourish your body and your soul, like eating foods that are nourishing and seeing food as a way of loving yourself, and factoring in exercise, not as a weight loss thing necessarily, but movement that makes you feel good, you know. And I always say to my patients, that might be like dancing around in your living room for half an hour a day. If that's what makes you feel good, then that movement is wonderful. And yeah, I think tapping into those things that really make you feel happier and bring you joy is really, really important.
Yeah, absolutely. That is such a great response to that, because and when you said about reconnecting with yourself or connecting with yourself, often you know, you're not even sure what that looks like until and then it's like, oh, okay, what is it? Who am I? What do I want? So connecting with yourself is absolutely brilliant, because yeah, as you say, you can have 1,000 luxurious baths and you can go and see movies with girlfriends, but until you really understand what drives you and that's a great idea. That's a great response. I love it. All right, so I put it out to the girls and I said, all right, what are we looking for? What are the answers that we're going to ask Thea? And so I'm going to cut to the chase, and these are some of the questions that that the girls have come up with. And this has come up a lot before as well, this first one. So should I start hormone therapy?
Do you want a one-word answer?
Yeah. Yes, but you know, as I was saying before, you know, it's something that I'm a huge proponent of, because I had it for 5 years and I don't reckon I could have survived without it. So I think I just really, all of those negative
absolutely
were around it was so it'd be nice to get some clarification around that.
No, I think my motto is don't be scared of hormone replacement therapy. I think there is a huge variation in symptoms that women can experience going through menopause. You know, some will have no issues with periods. One day their periods will stop, they'll never feel any different, and they'll just go on with their life. And other women will have horrific periods, bleeding that's prolonged and heavy and painful, lots of menopausal symptoms, you know, that can include hot flushes, vaginal dryness, changes in libido, mood, sleep, weight, all of these wonderful things. And they can struggle with those symptoms for years. And so there's no one size fits all answer, but I guess my hope is that women don't suffer with those symptoms, and that they find a gynaecologist or a health practitioner who listens and educates them about what's going on in their body around menopause, and then gives them a very sort of thorough explanation of what options are available. I think, you know, there are many options ranging from lifestyle changes to herbal supplements to non-hormonal medications, and then there's the option of hormone replacement therapy. And certainly that is the treatment modality that probably covers the most bases in terms of symptom control. And I think we shouldn't be scared of it. You know, the big studies that were published 20, 30 years ago, looking at the safety of hormone replacement therapy, back then reported that hormone replacement therapy increased your risk of stroke and cardiovascular disease and clots and breast cancer. But I always say to my patients, the way that they used hormone replacement therapy back then, the types of patients that they used it on, and the way that it was delivered is completely different to the way that we use it now, like completely different. And so the trend now is more towards using body identical hormones as opposed to synthetic estrogen and progestins. And we've altered the way that we deliver those hormones to the body. So whereas they used to be just taken in tablet form, now we know that it's safer to take estrogen through the skin, so that can be with a patch or a gel, and then to have progesterone delivered either in tablet form or even via IUD, so using a Mirena to deliver progesterone to the body is a really safe way of doing it as well. And certainly by using hormone replacement therapy in that way, there's really no risk of stroke or clot anymore with transdermal estrogen. There's virtually no risk of cardiovascular disease, and maybe a very small increase in breast cancer risk to neutral. I think the data is emerging on what the body identical sort of hormone replacement therapy risk for breast cancer is. But yes, I think it's really safe and is so effective for so many women. And I think, you know, the age at which you're going through these symptoms is often the time when your career is hitting its straps and life is really good, and then you kind of floored by these new symptoms, which are really very, very treatable.
Yeah. And I think that's just it, isn't it? They are treatable.
Yeah.
I think, you know, certainly in my experience, of course, which is kind of the reason for Pure Health Hub, is just to talk about it as much as possible, because we really weren't talking about it, and it was just the thing that shoveled under the carpet every time. So it's good to know and hear that everything's, you know, ultimately treatable.
Yeah.
Right. So there's ways to minimize and even reduce or even eliminate.
Yeah. I think ultimately, like, having a discussion with someone and kind of tailoring the treatment to exactly, you know, you and your general health is really, really important.
Yeah. Great to hear. It's good to hear. There's more coming online. All right. So then how will menopause, so for those women just coming into menopause or perimenopause, how will menopause affect my libido?
Yeah, I mean, so I guess in terms of what's happening during menopause, is that the ovaries only have a finite number of eggs within them. And throughout life, the number of eggs declines to the point where eventually there's no more to be released each month. And it is the production and release, the growth and release of an egg that produces our female hormones. So estrogen, progesterone, and a little bit of testosterone. So not all women experience menopausal symptoms, not all women experience changes in libido during menopause, but it is a very common symptom. And, you know, libido is a complex thing. It's never only hormones, you know, there's...
No, that's right.
There can be pain that can impact on how you feel about sex. There can be, you know, historical things with trauma history. There can be relationship difficulties. There can be stress at work, lack of sleep. You know, all of these things play into it, and it's really important that we take a thorough history to kind of elucidate what other things might be impacting. But certainly there is a condition called hypoactive sexual desire disorder, which is lower libido after menopause, and definitely there are treatments available for that. A lot of women will just respond to estrogen, and certainly one of the common symptoms post-menopause is vaginal dryness, and sometimes that can be the thing that's making women not so eager to have sex. And so just using some vaginal estrogen cream can help to alleviate that symptom and reduce pain from intercourse. And then, often using traditional hormone replacement therapy with estrogen can help to improve libido. And if that doesn't work, then often we'll use a little bit of testosterone as well, which also has evidence for it in improving libido in postmenopausal women.
Wow, it is complicated, isn't it? No wonder we've been wondering. It's so good to have specialists in this field. I mean, I'm sure we've had them, but there seems to be more now, which is great. So, and a lot of people get concerned about pharma and having to take too many meds or whatever. Are there any natural supplements that we could be taking to help with the symptoms of low libido?
Look, specifically for low libido, perhaps not, but I think looking at herbal supplements for menopause overall, there is evidence that a few can definitely help. There are a lot of studies looking at black cohosh or remifemin for menopausal symptoms, and that definitely has been shown to improve estrogen levels slightly and reduce hot flushes, and so that could also have an impact on libido if we're looking at it that way. I think thinking about vaginal dryness and alleviating those symptoms in a natural way, there's definitely it's definitely worth looking at lubricants and having a really good lubricant to use around the time of intercourse. There's also a gel called hyaluronic acid, which can improve the moisture content of the vaginal skin, which can really help with pain during intercourse as well. So there are lots of different things we can do, and certainly lots of herbal remedies for menopause that can be beneficial.
Oh, good to hear. Good to hear. Because
Yeah.
I've got a lot of people, and it comes up on the hub a lot. Everybody's sort of like, yeah, okay, can I just try these other kind of natural therapies first? And I think once talking to you or, specialists in this field, I think it's reassuring that you've got options.
Yeah.
Now getting to this sort of more, well, it's all serious, but in terms of the medical side of things, if I haven't had a period for a number of years, do I still need to get the annual checkups like cervical screening, the pap smears and mammograms?
Yes. Definitely. So it's really important to keep up screening. I think the two most important ones being cervical screening and breast screening for postmenopausal women. Even if you've not had a period, that is an independent factor of your risk for cervical cancer. And we know that the risk of cancer does go up with age. So having a cervical screening test every 5 years remains really important, as does having breast screening done every couple of years or more frequently if you have risk factors. Yeah,
okay, that's good to know, because that's really important. I think, some of us might get a little bit, well, not slack, but it becomes that you don't think about it as much, right? It's no period's coming, there's no,
Absolutely. No, really.
Yeah, so that's good to know. All right, we talked about all the desert issues. So traditional Chinese medicine and other natural therapies, diet, exercise are all vital components to a healthy next stage of life. But what else could we be seeking out? I'm sort of thinking physio, but what other practitioners could we be seeking out to support this menopausal and postmenopausal phase?
Oh, there are so many. There are so many wonderful allied health practitioners.
Yeah.
I think like Chinese medicine, you touched on, acupuncture is a really good one. So acupuncture can be really beneficial for menopausal symptoms if people are struggling there. I think, as you mentioned, physiotherapy, really good for pelvic floor strengthening. So I think for women entering menopause and the postmenopausal years, the decline in estrogen can have impacts on the pelvic floor and the health of the vulvo-vaginal skin, which in combination with the history of pregnancies and childbirth can impact on the function of the pelvic floor. And so I guess we're talking about things like incontinence and prolapse. I think seeing a physio preemptively is never a bad idea. To get a refresher about pelvic floor exercises and kind of get you on the right track, so that hopefully you're strengthening your pelvic floor before you're needing to actually manage any symptoms of prolapse or incontinence. So I think that would be really important. A dietitian is always a really good one, and we have I refer lots of patients to the dietitian, even just for sort of perimenopausal weight changes. So people are often curious about sort of what diets they can look at for that transition. It's normal for weight distribution to change around menopause. So the female weight distribution is typically sort of around hips and breasts, and then often it becomes more around the abdomen as you go through menopause. And I think that's normal and we should just embrace it. But I think getting dietary advice just about, what are the best things to be eating throughout that transition is really important, because I think people will often start to restrict food. And so I have a lot of patients who come in saying, I'm gaining weight, so they're trying not to eat. And in actual fact, that has the reverse effect, because it's meaning that insulin levels are all over the place. And so actually trying to have really good regular meals with lots of complex carbohydrates and really good amounts of protein is the other thing that's really important during menopause. I think that's really important. So chatting to a dietitian.
Yeah, look, I'm glad you raised that about the dietitian, because what I've found just personally, your diet fundamentally changes anyway, right? You don't need as many calories, or as you did. You feel like you don't. You eat less. But then there are certain things that are probably going to give you more energy, as you say, like proteins.
That's right.
And I think getting a really good view of those things, and particularly a more contemporary version of what's best for you at this point. So that's a really good point, I think. Is the
and I think, exercise wise, we know that resistance training and sort of, Pilates and gentle weights are really good for post-menopause, maintaining muscle strength. So that's the other thing, is keeping up some sort of physical activity is really good. But
Pilates is brilliant for that. I've done it for about 10 years, but I think it is phenomenal in being able to build that inner strength. And when I say inner strength, I mean the physical strength. I absolutely love it. So that is a good one, isn't it? Riding bikes and things like that, if you're still up for that. I love it. So the physio is a good idea, the dietitian. Anything else that you can think of that we could be doing, that I think we've covered off here that perhaps presents to you frequently?
I think really keeping up physical activity, looking after your pelvic floor, and then thinking about alternative treatments for menopausal symptoms. So acupuncturist and Chinese medicine. There are certainly women's health naturopaths who are really, really experienced in helping women to manage the menopausal transition. And so a naturopath sort of specializing in women's health can be really helpful as well. And then someone to help you with strength and conditioning, I think.
And I think that visiting a naturopath is, because it's so easy for us to go to the health food store or the supermarket and just buy $1,000 worth of vitamins that are completely redundant, really, or not effective at all. So it's important to understand what you really need, what your body's missing.
That's right. Yeah, that's right. And what things are actually going to have the most impact for you, rather than just that kind of
and those multivitamins or whatever, which exactly. So super important. So naturopath is another one. I'm loving because you're from Vera Wellness and Vera Women's Health, right? And Eva, is it
Peter?
Eva is the other clinic.
Eve.
Eve, sorry, Eve is the other clinic. I should have written that down if I was any kind of interviewer. So you're looking more at expanding a more holistic view of women's health, right? With the medical background. It's so good to see that happening so much more now. So it's great to be able to bring that perspective to our audience at Pure Health Hub. So thank you so very much for taking the time to chat with me today. A huge amount of tips there and opportunities and knowledge to share with women who are just really not sure where to start. So I really thank you for that today. It's been a treat to chat to you.
Oh, it's a pleasure. Thank you for having me along.